Hello and welcome everyone to the latest edition of the ALS Association Greater Philadelphia Chapter Podcast. I'm your host, Tony Heil, here at the chapter, doing communications and public policy work. And if you've listened to our podcast before, you know we have a whole host of topics, and using host to give it two different meanings in one sentence. But we have had podcasts with people with ALS, caregivers, researchers, legislators, people who are sponsors, all have different perspectives. And our chapter has a lot of different perspectives in our most important department here at the ALS Association, and that is our Care Services Department. If you go back into our archives, you can find a podcast with some of our social workers like Ann Cooney and Melissa Call and Janie Eskovitz. And you can also find with our nurses like Sue Walsh or Wendy Barnes talking about in-home care. But today we have a very special podcast with our Director of Care Services, Steve Spaulding. And I apologize that the first word I stumble on is Steve, which is an easy word. But Steve is going to give us an overview of his background, what he does here in Care Services, and some of the topics you may be looking forward to learning about here in 2018. Before we get into our conversation, I want to recommend to all of you to visit our website, www.alsphiladelphia.org, to find out how you can donate, volunteer, advocate, get involved, and follow us on social media, Facebook, Twitter, Instagram, YouTube, and maybe a couple other things here and there, all at ALS Philadelphia, all one word, to share your stories and get involved. So, without further ado, Steve, welcome to our podcast.
Thank you, Tony. Appreciate it.
And it's been a few months since you've been here, so let this be the podcast welcoming to our chapter.
Okay.
So, Steve, you started with us in July of 2017.
Correct.
And what was your background a little bit before you came to the ALS Association family?
Well, before I came here to the chapter, I worked for about 20 years or so in healthcare, and specifically working with chronic care, end-of-life issues, and serious illness. So I worked with patients, clinics, families, did a lot of direct clinical care and work, and managing teams that treated folks in hospital settings as well as outpatient settings.
And so you've met with lots of different people who've had various kinds of chronic illnesses. Mm-hmm. So you understand you understood before this, maybe not how ALS affects a family, but how those kind of diseases can affect not just the person, but the entire family.
Yeah, my background was broad enough to give me really an experience of many different illnesses and the challenges that come with each one, including ALS. Mm-hmm. But this is the first time in my career I've had the opportunity to focus in on helping folks specifically with ALS and bring hopefully all that experience and learning to here and to the service of our patients and families and individuals that are trying to pursue the best quality of life.
So as you said, you knew about ALS, you've had some interaction with ALS before, and now in this role here at the chapter, you can really focus on this one disease and all of the aspects of that. What's your feelings on that? Is that something you really like, that you can dig in and make sure to support families all on one thing, and you can really get all around one topic as opposed to being in 10 different places at once?
I really enjoy it. Having been here since July and now into February, I've had enough time under my feet to really get a sense of the mission and a sense of the needs. And obviously, as you said, my department is involved directly with helping to provide that. The whole chapter is, but we have the privilege of being able to be really engaged directly with that care and support that folks need from us. And so it's exciting for me to be involved in that and on this level, and to help not only carry forward a great legacy, but build on that and take advantage of all the new things that are coming along and opportunities to do things better and serve people in new and better ways.
And you mentioned the mission, so I would hear, what does the ALS Association mission and message mean to you as someone who is newer to the ALS Association, but not too new now, because now you've met all of our families, you've met our families, you've been to our clinics and whatnot?
Yeah. Well, I think, as you said, I've gotten a pretty good sense of it, and it's always a learning curve. But I can tell you what I know today is that the mission of my department and the mission of our chapter is really to serve those who have ALS, their families, their caregivers, those who love and support them, and at the same time to pursue, obviously, the research for a cure. So that's our twofold mission, and there's a lot built around that. But specifically where I come in and where I focus my efforts a lot, of course, is in the care and support of those with ALS and their families and caregivers. And so, the mission for me is, of course, what it has always been. But what I hope to do as we carry it forward is not only to continue to be able to provide all the great services we have for many, many years, but to build on those services. And I think there's great opportunities to do that, not only in terms of the number of services we provide, but also in terms of how we provide them. There's new technologies, there's new opportunities in the way we deliver services to people that people themselves are becoming aware of and want, and have heard about. And if they haven't, we hope to be able to introduce them to those new opportunities, as well as build partnerships and collaborations with all those providing ALS services in our chapter area. You spoke of mission, and one of the big things that I want to build on is it has always been the mission of our chapter to serve all those with ALS in our community, in our chapter footprint. But I think, sometimes we want folks to know that we partner with some great clinics in our region that provide great care. But we partner with all clinics in our region, and we want to be a support to all folks with ALS, whatever clinic they may go to. And if you don't go to a clinic, if you don't choose to go to a clinic, we still want to support you. We'll encourage you to go to a clinic because we feel that you're going to get the best possible care. But if for whatever reason you make the choice you don't, we respect that. And we still want to be there to support you and support you in whatever place you go to, while at the same time working with our partners who do great work in those clinics and help them to produce really great outcomes for the families and the patients.
Yeah, I've noticed from my years here, from knowing the Care Services team, and we'll do a little bit of background on them in a minute, but everyone I've met with that does care services with our chapter, whether they go to our clinics or not, when they meet someone with ALS that they don't know, the first thing they think is, well, how do I connect you to what you need? How can I help you? It's not, oh, well, why aren't you using our thing? Like, it's not about pride. There is pride, but it's more about what can I do right now? It seems to be a real sense of urgency amongst the Care Services team here to make sure that when they meet someone that has ALS, they're getting all of the services that they can get.
Yeah, that's absolutely true, and I appreciate you saying so. We are blessed with a great team, some very talented professionals, but most of all, some very dedicated professionals who for years have been providing great care, and some of them very new like myself, who have come on board in producing great care for people now. And one of the things that I think they do, as you said, is they don't delineate. If they're working with a partner clinic, great, and we want to provide every level of service we could possibly provide. And if they're working with another clinic, another provider, a community neurologist, we still want to provide and support them, and we do every day. And we're thrilled about the opportunity that we have every day. I come in here, those opportunities knock on my door, literally or figuratively, to do that work, and it's exciting and it's great.
Well, we're going to talk in a minute about all of the people that are part of the Care Services team. And to learn more about that team and how you can get involved, again, visit alsphiladelphia.org. We're going a brief introduction and overview here, but you can learn more about those programs and about the people behind them on our website. So you manage a team. How large is the Care Services team, and what kind of roles do they have? I don't need you to give, like, so-and-so does this, but how big is a team, and what kind of roles do they encompass?
Well, we have a lot of social workers. We have nurses that work with us. We have assistive technology specialists, who are folks, if you don't know, that provide support to the technology that supports our patients. The power wheelchairs, the communication technology, the assistive supportive technology to help them function. We have folks that manage our in-home services and manage the ramping and the stair glides, and every area of our programming has specialty and support to it. And as I said, many of them are nurses and social workers, as well as mental health services. We have folks that provide that as well, so that people who, for obvious reasons, struggle sometimes with the illness, either the individual themselves and or their family member or caregiver, we try to reach out and support them, or we're here for them if they reach out to us. And whatever that need is, whether it's a physical need, a medical need, an emotional need, we try to be available to them.
And you know that if you have someone like Gail Houseman, who's a nurse, while she's incredible, she doesn't do anything on her own, right? No one here does anything on their own. There's a team approach at the clinic and beyond, correct? And how does that work?
It is, and I'm glad you asked about that, because, in healthcare, a lot of people have heard about the interdisciplinary approach, the team approach to care.
Which is a big word.
It's a big word. But it's been put out there on poster boards, and everybody's heard about it. But I'll bet you, if you took a survey, not a lot of folks could share with you experiences where that really happened in real life when they went to their healthcare provider. And that's unfortunate. Some could, but a lot could not. And we can say with great confidence that when folks go to clinics, ALS clinics, or they come to work with us in their homes and in the community, they encounter an interdisciplinary team, which means it's a group of people with different skills who come to the table and help them with all their different needs to the best ability we can. Obviously, we can't always meet every conceivable need that a person has, but we have many programs, we have a lot of resources, and we try to bring all that to bear to be of assistance to the greatest extent we can be.
Mm-hmm. And like you said, Gail might say, here's who you talk to for this, here's who you talk to for that. So everyone works together. You've had a great experience in healthcare before here. Would you say that this is the most interdisciplinary, like the best team approach that we have here? And it's always getting better too, but you don't see this at the same level everywhere else? I know I don't for other diseases and locations.
That's correct. You don't see it. And having worked in healthcare, I can speak from experience that that's true. I was fortunate to work with some folks that had pretty good team processes in place. I know what that looks like. I know how to build that and how to manage it, which is part of what gets me excited being here and being part of the same kind of concept. But I can certainly say that in comparison, we have excellent teams here. Our clinics have excellent teams. And most of all, our patients and families benefit from that concept and have the ability to tap into that and get different types of support. So if you go to a clinic and you need respiratory support, you can get respiratory support. If you need nutritional support, you can get nutritional support. If you need physical therapy or speech therapy evaluations, you can get that. You can get emotional support. There are very few places in the world you can go to and get all those things in one place. And very few organizations you can go to from home or in the community, like our chapter, where they can help you in all those different ways. And even if they were to call me, for instance, or one of my staff, and that's not the specific individual for their need, they can refer them to someone who is.
Yeah, and that's a big deal that people know all those things. I know from talking to like Wendy Barnes, who's here today, so one of our social workers, she'll be talking to Gail about someone they both know and say, I noticed this. Do you know that? Can you help that person? So they can all use their own strengths and contacts to help somebody. But you just said the heart of the chapter and the heart of your work is the clinics. If you're a person with ALS and you want to go to an ALS Association clinic in our territory, where would they be going?
Well, we partner.
This is where we can list our clinics.
Right. We partner with some great partners. We're fortunate to partner with Jefferson Hospital in Center City, and as many hearers know, they enjoy an excellent reputation as an institution, and their ALS clinic is top notch as well. They do an excellent job. They have a very strong interdisciplinary approach. You go there, you get very hands-on, personalized, compassionate care, and you meet everybody you need. And then there's the follow-up, and they coordinate almost seamlessly with our chapter in terms of follow-up to home. So clinic to home, home to clinic. And that process, that model is replicated in a lot of our partner clinics. So we'll hopscotch over to another wonderful institution where we also support an ALS clinic, and that's the Hershey Medical Center in central Pennsylvania. And those folks also enjoy an excellent reputation. Our ALS clinic there is top-notch. And again, our chapter is integrated with the clinic, and so the clinic provides great care. When you go home, you get the support of the chapter, and we bring you back to the clinic, and you have that full circle of care and support that is so reassuring to people. You know, there's nothing worse when you're dealing with illness of any type, certainly illness like ALS, where you feel alone and you don't feel like you have support, and you're flying solo. So to those listening right now, I think of all the things that could be consoling and supportive, it's to hear that you have the opportunity to have something there for you that you can reach out to whenever you need to and get the help and support. And it's not a one-timer. They're there the whole time.
Yeah, and people go to that clinic 3 or 4 times a year, oftentimes, right? They go every few months on a regular basis. So in Philadelphia, we support the Jefferson Clinic at Jefferson University Hospital, and then there's Hershey Medical Center, and then the Lehigh Valley.
Yeah, and then to again hopscotch to other regions. So we have Lehigh Valley Hospital, another excellent institution, and we have a clinic there that runs really, really well and does a wonderful job.
With Dr. Mackin.
Correct.
Who you're going to convince to do a podcast with me this year. Right?
Exactly. And he's a wonderful physician and very committed to the families he's taken care of for many years. And then we hopscotch over to New Jersey, and we have a partner at Meridian Jersey Shore Medical Center in Neptune, New Jersey, and Dr. Mary Sedaris there. And again, the same model, the same great care. We also partner with an organization called Dancy, which some of our listeners may be familiar with, who supports the very localized community of folks with ALS in central New Jersey. And we are very strongly partnered with them, and we work together collaboratively to help support the folks in central New Jersey and then southern New Jersey. And then down in Delaware, we support the folks in the Wilmington area as well as all the way down through the peninsula. And speaking of peninsula, we have an ALS clinic that we partner with at Peninsula Medical Center, who support the folks down on the peninsula side of Delaware. And they do a great job there, and we help to really build that up and give them the resources they need to be able to support folks who, would have quite a distance trip to get to hospitals in some of the bigger urban areas. So there's a broad swath of what we try to reach out and do for folks.
And then there's the Geisinger system.
Exactly. Don't want to hopscotch up there.
Yeah, that's a lot. That's a big hop.
It is. It's a big hop. But, all of this is our chapter.
Right.
And when we talk about Geisinger specifically, we're talking about Wilkes-Barre and Danville. And those areas, again, have their own unique communities, are a distance from some bigger urban areas. And so it's really important for them to have the opportunity to have good, solid clinics that they can go to and get good care and get a good model of care and support, both in the clinic as well as at home. And that model is carried out there as well.
And for people who are listening, this might be the first time learning about these clinics. You can find their contact information on our website, alsphiladelphia.org. And we have a lot of newly diagnosed people every month, which is unfortunate. I don't know if it is unfortunate because you don't want anyone to have ALS, but you do want them to have their diagnosis if they have ALS so they can come to get our services and get the support they need. But you would rather that they go and, if they have questions, go to a medical professional like Dr. Simmons at Hershey or Dr. Okosovic at Jefferson or Dr. Sedaris at Meridian, not to name drop everybody, but that's,
sure, absolutely.
So you would recommend as a director of care services, find your clinic, get the support you need, and talk to those professionals about the services that are available and get the real medical advice, not just going onto Google.
Absolutely, and in our experience, that's the best possible model for folks. Having said that, I understand that some people don't have the options or feel that they're not able to get to clinic, and we work with those folks too, and we support them, and we'll do everything we can to give them resources. The other thing to mention at this time, since we're talking about resources, is rather than just Google anything, I do encourage people, and many of our listeners may already be aware of this, to go to our website. And you mentioned it earlier in the podcast. There's a lot of specific care service resources on there for people. It talks about early diagnosis. It talks about symptom management. It talks about just understanding the disease process. And also, what can I anticipate? What do I need to do? Let me understand this better. Mm-hmm. There's a lot of content in there that can be really helpful to people as they try to learn from a reliable source what the disease process is really all about and how you deal with it, and to the best of your ability.
Yeah, there's a good starting point on our website, and that lists some of our services, for example, and that you can run them down, like the Abrams program and whatnot. I don't want to take your credit, but so what services does your team help to deliver? You mentioned that they do, but there's the Howard I. Abrams and Home Care program.
Yeah,
and then there's other programs that we have that other chapters don't even have, much less other disease organizations.
Yeah, that's right. And as you mentioned, the in-home program is really, really a stellar and amazing program because we provide hours of support for families who need in-home services. And when you become disabled to the point where you need care at home, that becomes really, really critical. It allows caregivers to get the support they need to stay at home, sometimes to be able to just take care of basic needs every day. Some folks are working and need that support, and either we can, we try to augment the services that they have from elsewhere, or we may be their service if they have no other services in terms of in-home. We provide the ramping, which allows people to get in and out of their home. When you're no longer mobile and you rely on a power wheelchair, and even if you're no longer mobile and you're just in a standard wheelchair, you're no longer really in any easy way able to get in and out of a home with even one or two steps. So ramping becomes critical. So we provide ramping to people, either sharing the cost with them or absorbing all of the costs when they're not able to afford it, so that they have the ability to get in and out of their house. We try to provide opportunities for them to identify vans so that they can purchase the equipment they need to be able to become mobile in terms of driving. And we provide a van service to a limited degree here in the Philadelphia area that allows us to provide some support to folks so that at least they have the ability to get around when they can. We also provide stair glides so that people can get up and down, at least early in this disease process. That can be helpful to certain people in their home to get up and down. And then we have a lot of other interesting programs where we provide a lot of program support, resources, support groups, visiting volunteers who are individuals who oftentimes have experienced ALS themselves with a family member, spouse, or loved one who later offer to come in and visit with people and just be an emotional and friendly support to people. So all of these things really become important for many people.
And people don't even know what services they would need, because most people when they have ALS have no idea what ALS was, right?
Right.
It's not a disease that usually, there is a familial aspect, but most people didn't have it in their family history.
Correct.
So my grandfather had ALS, and I think what I learned is you don't know what you don't know. So people like our social workers are there to let you know what you don't know, what's available.
Correct. Yeah. So you're not, and that's a good point, Tony, that, it's not just about here's what we have and good luck and, read our pamphlet. There's people to talk to. You don't call our chapter and get a 300 list of push number 1, push number 2, push number 3, and then, this automated message tells you what you need to know, and there's nobody to talk to. If you don't reach somebody here and you leave a voicemail, we call you back, and 9 times out of 10, you reach somebody, and we talk to you. So there's a person who can help you and work through your specific issues. Because, with this illness and with a lot of illnesses, there's very few things that fit into one neat little box. It's usually something a little different, a little out of the box, requires another person on the other end of the line to talk it through and figure out how to best help.
Well, we're always looking at new ways to help people. We're always looking at ways to improve our care, or at least your department is. So 2018, it's hard to believe that 2018, I think last year was hard to believe it was 2017, so that happens every year. But
yes.
What are some of the ways that your department's looking to improve or add new ways of care in this year that people might be interested in learning about in future podcasts or in future communications? What do you see on the horizon in the near term for our chapter services?
Sure. Well, one of the things, of course, and some of our listeners may have some experience with this and some may not, but, one of the exciting things that's come along in the last 2 years and is rapidly developing is the ability to take things that many people are very familiar with and turn them into assistive devices. So, for instance, an iPad or an iPhone, or any other type of smartphone. These devices, which are pretty common nowadays, are now developing technologies that can help people with disabilities and can help folks with ALS with their disabilities. And we have an assistive technology specialist, Elisa, as well as a whole host of knowledge and consultants and support to help people understand how they can tap that for themselves, get them set up, help maintain it, and use that. We also have assistive technology that may not be as readily available as part of our own little loaner closet that we loan out to people. And if we don't have it, we work with families to try to figure out how they can get access to it, either through their insurer or through other grants or supports. Sometimes veterans have special resources that we try to help them tap.
Because veterans are twice as likely to be diagnosed with ALS.
Exactly.
We don't mention it enough, because you can never mention it enough. But.
Yeah. So all of those things are really, really important. So that's a growing field, the whole assistive technology piece, and the fact that it's gone from big, specialized equipment that used to be available only through one provider, and you didn't even know what it was, what to call it, to things that people are familiar with, but they just need to know how to access the technology. And so our assistive technology specialists work with families to help them understand, hey, as a matter of fact, let me show you how you can access that and get that set up for you so you can use it. And for those things where there is a very specific piece of technology, we do that too. Our loaner closet has been for years loaning power wheelchairs to folks while they either await their own power wheelchair, or maybe they'll never be able to qualify to purchase one for themselves because they are extremely expensive. And one of the things we do is we try to outfit those power wheelchairs, personalize them so that the person's very comfortable, but also so that it can retrofit all of that assistive technology so people can have the ability to communicate and connect. And these things are not new per se, but the technology looks different. And it's smaller, and it's lighter, and it's more accessible, and that is new. Right. And so it's something pretty exciting and important for people, and we're very excited about that.
And as you know, and we don't need to go into detail because we're trying to get more information here, but that technology getting smaller and lighter and easier to use is not just good for the person with ALS, but it's just as good, if not more important, for the caregiver helping them, because those wheelchairs are hard to handle. If it's someone who can help that, if it can help that caregiver, that's a big difference.
Absolutely. Yeah, it just makes a huge difference for people when it's less complicated and it's more familiar and more user-friendly. It's one less headache, one less burden for the caregiver. And of course, the individual with ALS themselves feels better that their caregiver, who might be their spouse or their family member or even just a professional that they love and work with, it helps them to feel like life is easier and that they care as much about them as they do themselves in many cases.
Yeah.
The other really exciting piece is with our resource and support groups. You know, the traditional support group of folks going to a location and getting together, usually in a decent sized room and talking and supporting each other, has always been a critical and important concept and something that has helped generations of people get through difficult times. Caregivers supporting one another, individuals with ALS themselves supporting one another. And we do offer those. We have offered those for years, and we continue to offer those, and it's great. At the same time, there's so many new opportunities today to do things differently and offer opportunities for people to connect in ways they couldn't before. One of the things that's really challenging is we have a lot of individuals later in their illness that mobility is really a challenge. It's a 3-hour process of getting somebody out the door and bringing them back home, and then the transport in between, and having to have somebody stay with them during a group. And some folks make that trek and they want to make it, and more power to them. But we want to offer the opportunity for people to attend a support group from home. And so we are developing remote groups where people can attend a group without ever leaving their house. And folks who don't have the ability to communicate very well or at all, except perhaps through typing, will have the ability to communicate and engage in a support group remotely. One of the really exciting things that we're working on, just as an example, is a yoga group that we're developing that's going to be offered through a Facebook platform. Many of our listeners are very familiar with Facebook. It's a very user-friendly platform.
I've heard of it.
Yeah, we've heard of it. It's been around a little bit. And yoga and mindfulness, which is a type of meditation that's often used in tandem with yoga, has really been proven to be very, very helpful to people who deal with illness and chronic illness or just emotional challenges. And a lot of people think of yoga as something for those who are very physically, healthy and can move a lot. But that is not true. There's something called adaptive yoga, which is for folks that really have very little movement and don't have the ability to do a lot. And it can really be a very freeing, really great positive experience for them. And it's really crossed the whole country and much of the world. This concept has proven to be a huge benefit to people's quality of life. And so we want to offer it here. And one of the exciting things we're developing is a yoga remote group where those with ALS and their families or caregivers can attend through Facebook and get the opportunity to participate in live sessions with moderators who conduct a group. They'll be able to visually see it and engage in it. And then in the off times when there's not a live group, they'll be able to see a recording of somebody doing yoga, adaptive yoga, and it could be the middle of the night for them. And they could sit there and watch that and help them to do that for themselves or do it together with their spouse or family member or a group. So that's just one example of some really, really exciting new ways to take an old concept and broaden it and build on it so that people have more options and more opportunities to be supported in all the different settings.
And like you pointed out, you're able to do those programs because of the team approach with people like Elisa helping with the future of assistive technology, Lea with the different groups online and resource groups. So there's a lot of positive things in the future for Care Services. And for the people who are listening, we're going to have some follow-up podcasts to this, talking about, in short snippets, the people in charge of those departments or those new things, like Lea, like Wendy Barnes, like Elisa, to talk about the future of these programs and questions you may have about them. So please be looking for those. We're at our time today. But thank you, Steve, for giving an overview of our departments. Is there anything else that we want to quickly let people know about where they can go for resources or help?
No, I just to say thank you for the opportunity to speak with everyone. I've met a lot of folks. I'm looking forward to meeting more. And always feel free to reach out to me. I love to hear good feedback, and I love to hear new feedback about things we can do better. So I offer that. I always offer that to folks, and we'll keep folks posted on these exciting new developments as they broaden. And I'm excited to have our staff speak through the podcast to everybody out there and to hear from each of their perspectives, some of the things they do to kind of help make a difference every day.
Yeah, I agree with you. It's good to get not just the good feedback, which is nice, but when someone says, I wish that the chapter did that, it's great to hear that because now we know something we can do better. As a
Absolutely.
Yeah. And so you please get in touch with us. Our contact information is all www.alsphiladelphia.org. That's how you can find some of the resources that Steve just mentioned, also how you can donate, how you can sign up for an event, or learn about volunteering and advocacy opportunities. Thank you all for listening, and look for us on future podcasts and subscribe to us on iTunes. We're looking forward to working to fight ALS together. Thank you, Steve.
Thank you.